Nanoscope Therapeutics is on a mission to cure rare eye diseases that are stealing the sight of victims every day. Caroline Woods sat down with CEO Salagna Bhattacharya to discuss how the company's technology is helping treat patients and even restore their vision. Let's take a look.
Retinal diseases today, majority of the therapies, they are focusing on slowing the vision loss progression or holding whatever remaining vision left. Our approach from the day one was different, fundamentally different. What about the patient who are legally blind or lost their vision already? We need to bring those patients back to their life, give their dignity back, give their independence back. So what our technology is doing in these retinal degenerative diseases, whether it's retinitis pigmentosa, commonly known as RP, or Stargardt disease, which is juvenile macular degeneration, or even macular degeneration, patients are losing their photoreceptor, rods and cones, and these are neurodegenerative diseases. Once you lose the photoreceptor, you lose it for life, and at one point, it becomes imminent that you are going to lose your vision for life. Our technology makes the next layer of cell in retina, which is bipolar cell, which is still intact and in healthy and viable. Our molecule goes there and it makes a new photoreceptor. So bipolar becomes your de facto photoreceptor. These IRDs are very complex. There are over dozens of IRDs. These are all rare diseases, and over hundreds of mutations behind it. RP, retinitis pigmentosa, and Stargardt are the major ones. So we started with retinitis pigmentosa. We have shown in multiple trials, phase 1 to 8, randomized clinical trial, significant clinical safety and efficacy data over 3 years from randomized trial, and it's still counting that we are giving this patient their vision back and restoring it. So it has potential to be the therapy for mutation agnostic way to give patient their vision back.
So you could have a patient who is legally blind. Actually, you could help them be able to see again.
We have patients who are not only legally blind, their light perception, they barely can see lights. We are seeing even those patients are getting light sensitivity back, their ability back, some of the functional vision back.
Why is this such a promising development for people with retinal diseases?
As I mentioned, IRDs are very complex. It's genetic. Most of these are highly variable. So finding a cure for each and every mutation is literally impossible. Like for RP itself, there are so many mutations. And if you're unlucky like my family, then you do not know what's the gene behind your mutation. It's really challenging to find a cure for this. And that's what the biggest challenge when you see is the drug which is approved or in the development to finding a cure that can give this patient their visual function back.
How soon until patients can actually utilize this treatment to start to see some of these results?
We have started mostly with low vision patients because from day one, our target was to make sure the patient who are left out, who are legally blind, those patients can come back to the society and get some independence back, get their vision back. Because when we talk to the patient, sometimes holding their vision back or even like slowing down the progression is a big life-changing event for them. But here we are talking about not only slowing it down, we are talking about restoring it back, giving their life back so that they can get independence.
I understand you recently got some major approvals in Japan, still waiting for them here in the United States as far as I understand.
In Japan, we got Sakigake and Orphan. These are very, unique regulatory pathway for groundbreaking therapies. And if we get approved, this will be the first mutation agnostic, and not only mutation agnostic, it will be disease agnostic therapy, gene therapy in the history. So this is really groundbreaking for the field itself. Japan also, our application process will start soon. We got the breakthrough, which is the Sakigake, and this is the first time in a gene therapy without any Japanese clinical trial. So we are going with any Japanese clinical patient data It's all US-based data and our phase 1/2A done, abroad.
And then here in the US, how long until you could see approvals?
In US, we have Orphan and Fast Track that gives us, expedited path to communicate with the regulators. Our rolling BLA, which is the application process, already started, and we are now laser focused to make sure we finish the application by mid this year. So because of Fast Track and Orphan, we have potential to get priority review. And if we get it, then probably by end of this year or early next year, we can see the potential approval coming. So that is exciting for me to see that something that I have always dreamt of from my childhood is becoming reality. Because for me, it's a mission. It's a mission. We are fighting against these devastating diseases.
All right, everyone. Thanks again to Nanotherapeutics CEO Salagna Bhattacharya and Caroline Woods for that interview.